Now we are.
Okay, we'll call the Health Service Committee meeting to order. First, we'll have Office of the Aging. I need to approve the minutes of the prior meeting. I need a Supervisor Bruno, second, Supervisor Gilligan. All in favor?
Aye.
Okay, I just want to let you know Supervisor Wild will not be able to make it. He had another commitment. So at this point in time, privilege of the floor. Anyone from the public or from the board here have anything they'd like to address? Seeing none. B, you're all set.
First item is a request to submit our MIPA, which is the Medicare Improvements for Patients and Providers Act application for the period of September 1st, 24 through August 31st, 25 in the amount of $40,523. This application is due January 24th and it was released on December 19th and is 100% funded.
Okay, I need a motion from the floor. Supervisor Ronan, second, Supervisor Bruno. Anyone have any questions? Okay, call the question. All in favor?
Aye.
Opposed? Abstain? Okay, number two.
Second item is request to amend the contract with Countryside Adult Home to provide meals. This is to request an increase to $5.50 reimbursement and to increase the not to exceed amount to $150,000. The current cost per meal price is $5, and this is based on the actual cost per meals.
Okay, need a motion, bring it to the floor. Supervisor Runyon, second, Supervisor Thomas. Any questions? Okay, call the question. All in favor?
Aye.
Opposed? Abstain? Okay,
And then I do have just one update for you, kind of a discussion item. Back in August, we found some mold at our Lake Pleasant meal site. So I just wanted to give everybody an update on that. The Lake Pleasant Senior Center, they did have mold remediation done. The site was reopened in September. Unfortunately, we found mold again in December, so the site is currently closed. Needham Risk Management went up on January 10th, I believe it was, and we are awaiting the results of that. All the seniors are still getting meals. We're still doing home delivered meals. They're getting grab and go, the people that were coming in and dining in at the site. So everybody's still getting meals. They're just not eating in the location itself right now. If there's any questions on that.
no, I saw that. That's Hamilton County, right?
Yes, it is Hamilton County, so
Okay.
it's not Warren County, but I just wanted everybody to know.
It's no cost to us either way. Okay. Okay, anything else? Okay, privilege of the floor. Anyone else from the public board have anything to say? Okay, you're all set, Dean. We'll call Rob up next.
Thank you.
Oh, we need a motion. Supervisor Bruno, Supervisor Gilligan. Motion says right here to adjourn. We're all set. Thanks. Okay, Rob.
Could I make one comment, Mr.
Yeah.
Chair, just to make the committee aware? We have the New York State Department of Health on the last topic with Lake Pleasant, the issue there, told us to reopen the site and without going up there and looking at the site, and that's why we sent Needham Risk Management over to do a mold test to find out if there's actually mold in a building. If there is, Hamilton County, the town over there, is going to have to take their responsibility to remediate. But we did get some pressure from New York State Department of Health to reopen the site and send our employees into the site without even knowing whether there was mold there. So and we pushed back.
Nice.
Thank you. Okay, so Rob, you're all set?
Okay, good morning, everyone.
Morning.
Okay, my first item is a resolution request to reappoint one of our community services board members, Kimberly Brayton, a psychologist in the community. Her term expired actually on December 31st, but we'd like to renew her for another 4-year term to run January 1st, 2025 through the 31st of 28.
Okay, can I have a motion? Supervisor Thomas, second Supervisor Runyon, any questions? All in favor?
Aye.
Opposed? Abstained? Okay, thanks, Rob. Next.
Okay, second request is to appoint recently trained mental health professionals and support members to the Warren County Disaster Mental Health Team. There's an attached list of individuals. We worked with the Office of Mental Health to conduct the training. And we had a really good turnout, so I'm really encouraged. We have a number of professionals that are willing to volunteer in the event of some sort of mass casualty type event. And this team is coordinated by my office and is incorporated into the other county emergency response plans.
Okay, can I motion to read the floor? No, Supervisor Bruno?
Yeah.
Second, Supervisor Patchit, thank you. Questions?
Could you explain just briefly what these individuals do, just? It's an idea.
So all these individuals currently are like, most of them are private clinicians in the community, right? They might be in private practice or they might work in one of the agencies. And the idea of a disaster mental health team is these individuals are trained in a curriculum for disaster mental health response and psychological first aid. And so in the event of some sort of mass disaster, we would do a call out to the team. We would convene the team, deploy people as needed to, under the direction and guidance of our emergency services department.
They deal with people that have been.
Yeah, they would deal with people.
traumatized to that-
Yeah, yeah.
As a result of this
Yeah.
disaster.
Yeah.
Thank you.
It's quite an impressive list of people also.
Yeah.
Okay, so we'll call the question. All in favor? Opposed? Abstained? Okay,
Okay, and then in the last page, I did provide a table. I just wanted to provide an update on how the competency restoration expenses played out for the year. There's a little bit of a lag in the billing, so we really just received our December bill. And so unfortunately, you can see the expenses. We've been discussing it throughout the year, but the expenses have really just been off the charts this year. And it came in at a total of 1.6 million. So we were over budget, even with the numerous amendments we made to bring funds into this line.
do you have any questions?
We are, one other comment I guess I would make is that we are working with our statewide association and NISAC, advocating for changes to this because we're not unique in this. Every county across New York State has been dealing with a similar trend, of these expenses just really going to the extreme. One of the things we looked at, and we went back and looked at some of the statistics, and one of the things we see is that we've had, of course, in approximately 2021, New York State used to pay 50% of the expense, and they shifted that to 100% county. But also since that time, we've seen the number of individuals approximately double. We've also seen the average cost, the per diem cost, used to be a little bit less than $1,000 a day. And we used to always say, oh, it's almost $1,000 a day. Well, now it's almost $1,500 a day. So we've also seen that cost over the last 3 years really go up, by another $500 a day for each individual. So all these things together, I think, are coming together to produce this. We've seen the average length of stay almost triple. So there's more people going in and staying longer at a higher cost.
Is there
Yeah, please.
a degree of recidivism here? In other words, you get the same people coming back?
Not a lot, but we did look at that. There are a few, but in general, no, it's not the same group of folks.
That's good.
We have started some meetings. Christina's has called some meetings, and we're pulling in Jason Carasone, our DA, and Greg Canali, Public Defender, for some of their input and discussion on what they see and if they think there's anything else we could be doing.
Excellent. Thank you.
And Christine had put together a chart for that meeting, so I don't know if you want to speak to that.
Morning.
Morning.
So it's Tammy, it's myself, it's Rob, it's all of us frankly that are concerned about this area. Just a couple of points. So we just threw this analysis quickly together on the expenses. So what you're looking at here is the totals of the 731 psychiatric exams from 2016 to 2024 to 2024, and then what we budgeted for 2025. And it is correct, in 2021, New York State stopped expecting 50% from us and expected 100% from the counties. And that's just not Warren County, that's all New York State counties. In the literature that Rob shared with us, it was a budget assumption on New York State's part that they would only charge us 50%. They never actually budgeted for their portion of it. So it's not a hard, it's an assumption. It's not a hard budget line. So they didn't need to go and get approval or anything. Since like 1896, according to the documentation that I've read, it's always been supposedly 100% funded by the county, but the state has only requested 50% from the respective counties. And they put an assumption in their budget that is all they would request from us. So I don't know the ins and outs of, their budget terminology and law versus assumptions, but assumptions are generally just that, assumptions. It was not a hard budget item in their budget line. So again, in 2021, but still, again, in the reading that I've read, again, it's probably across New York State, there are a number of repeat vendors. But again, that might not be the fact specifically for Warren County. Rob's obviously done more diligence on that. But the length of stay has tripled, and a lot of it, there are people that are in over a year. And I think maybe some of the lines between mental health and restoration are potentially being blurred. Again, this is top level. We got to get into the details more. And I think the next set of discussions with Jason Carasone and Greg Canali are going to get us a little bit more information, because they definitely have a point of view on this. And we just need to get a little further. But right now, you've all said it before, this is a state mandate. These are state doctors. And while they need two independent, psychiatrists or psychology workers to say that these people can't represent themselves and they need to be restored, they're at state facilities. It's just, there's no balance. There doesn't seem to be any checks and balances. So I think it's interesting. John has said, and I've looked in the legislation for NISAC this year, it is one of their top priorities. But the cost, as you can see, from 2016 to 2024, it's a 4,000% increase. Actually, it's gone up even now because I've got better 2024 numbers. And again, it doesn't make any sense. That 2017, $24,000, 2018, $100,000. Excuse me, that's the change. The change is just significant. So forgive me. So in 2016, it was an actual of $28,000, 2017, an actual of $3,900. So, and then in 2018, we go up to 103,000. 2021, 100, or 21,000, 2020, 42,000, doubles 100%. But then it goes astronomically from 42,000 to 222 to 306 to 846, and now we're over $1 million. And with our 2025 budget, we're budgeted at 600,000, and so we're already 45% under budgeted out of the gate. But again, there doesn't appear to be any, except it's going up. That appears to be the trend. But I just think we need to do more work in this area, and maybe hopefully NISAC can help us out. Any questions? And I'd like to thank Tammy and Rob.
Good thing that you have a committee, so to speak. Can you look into this? Because
It's
something's
a little wacky.
drastically wrong.
Thank you.
Thank you.
Well, it's not pretty.
No.
But doesn't this really come from the federal government passing this to the states and then the state passing it on to us? Wasn't that the ones who started this process of making sure people that were able to stand trial? Is that where that all came from?
No, basically, it's competent enough to stand, mentally competent to stand trial. And so the process is if the judge did, if there's a question on a defendant's capability to understand the charges against them from a mental perspective, the judge can ask for a psychological evaluation. There are two required evaluation by two independent psychologists or psychiatrists in the county who make a determination whether a person is capable, is mentally competent enough to stand trial. And if they determine that they may not be, then they're remitted to these state-run facilities. Now, the NISAC has said that the reason they're state-run facilities is because the private sector, the liability would be so significant for a private sector company to take this on that none of them are willing to do that. And that's why the state has run the facility. And that probably will not change in the future because of the liability of someone saying, yeah, this person's competent enough to stand trial and maybe they aren't. So that's the issue. Thanks.
I'll just ask a clarifying question.
Sure.
So John, thanks for that clarification. So they're county psychologists, the two people that are assessing the individual's ability to stand trial and understand, they're county officials, they're not state officials.
They're private sector psychologists in Warren County who make the determination. But their determination that they're making is they may not be mentally competent enough to stand trial. And so then it's the state facility that makes the ultimate determination. And I'll defer to Rob, but I think that's.
So actually what happens is the court orders me to arrange for the examination, so I have to find examiners. So yes, they are local. They're in private practice here, psychologists, has to be a psychologist or a psychiatrist, and you need two.
Who
And
pays
then
them?
what they do, we do, and that's on that chart that I handed out, you know, so that's a portion of what comes out of this line. It's a smaller portion, obviously. But what happens is then they do their evaluations, make their reports to the court. The court is the entity that makes the decision. So even if the reports both came back as not competent, if the judge feels the person is competent, the judge rules that the person is competent. The judge does not have to follow the reports, in other words. It's a decision that the court makes. Now, generally, they do follow the
Right.
recommendations, reports that the psychologists make.
So thanks for that clarification, guys. So the only thing that I think is really, again, I think we're just gonna get some further information on this. But going from 90 days to maybe even 120 days to like people that are there for over a year, you know, just needing to understand how those lines, you know, between restoration and mental illness, and then again, whether or not they're again, across the state, I've been told, I've spread that there's a lot of repeat offenders, but maybe that's not the case here.
For us.
Go ahead, Supervisor.
Good point. I mean, what's the, when is a person, not just incompetent to try to understand the charges, but when are they actually mentally ill, if you will? And that would change that to another facility or what have you.
Right, and I think Rob said that the district attorney and the public defender definitely want to weigh in on that conversation.
Sure, I
So
think
that's our
great.
next step.
Just caution that from a NISAC perspective, the issue they're taking on is the fact that the state no longer funds half of this. They're not going at the detention facilities to try to encourage the detention facility to speed up their evaluation of someone in terms of competency and the CPL 730. So they're not And we as a county would not have the ability to do that as well. Our issue would be to help continue to advocate for the state to not put this entire cost on the county.
Supervisor Bruno?
But I personally think that's a fairly weak argument on behalf of NISAC. I'm all for them pursuing it, but as the treasurer stated, if going back to day one, it was never the state's responsibility to pay anything, then I don't know that you have, and knowing the state, they're just gonna say that and say, hey, we were never responsible for any percent, let alone 50%, so go away.
The other thing that I think is important, again, this is in the document, and I'm happy to share it with this committee, that Rob gave me with the history. I know I gave it to, the budget officer. In 2021, when they made this change, and I'm forgetting, Rob, who was the source of that document? Where did that come from? Was it NISAC? Where was it? Or was it New York State when they made the change in
I
2021?
think that was my statewide association.
There was a whole bunch of reformation discussed. Like, these are our strategies to reform this and to make this more reasonable. And that was in 2021, and there's been nothing since then. So I think I think it's just worthy of some further conversations.
Well, I have a question. So they go through this process and they go to the, wherever they go to get analyzed. And they come to a judgment that these people will never be able to stand trial. So what happens then? Do they stay on our dime out there at that facility, or where do those people ever go?
Right, there is a mechanism that they call it a Jackson hearing or a Jackson proceeding, where you can file that and petition the court with the argument that the person's not restorable. They've been there so long, they're not restorable. So far, it seems like that's more common when somebody has a developmental disability. In other words, they're just not going to be able to be restored and understand their charges and be able to assist in their own defense. So there is a mechanism that you can go through for that. However, all of our people that we're talking about, that we've looked at, are not the individuals with developmental disability. Now, we have had some long-term people in there, so that's one of the things we're looking at is what's the mechanism to initiate a Jackson hearing for an individual that's been there, for a year, over a year. Because it seems like that's so long that maybe potentially they're not restorable. When we've broached that with the state, they have indicated that they will look into it. To me, it seems like we ought to be able to, maybe we could be the initiator of a Jackson hearing, but that's one of the things we're starting to talk about with Jason and Greg.
Supervisor Patchen?
What percentage of people get restored at the state facility? Have good success rates?
Yeah,
You do.
yeah, they do. I don't know a number like to throw out at you. I mean, we can look at that as we're looking at these statistics, but yeah, most people do get restored and they return to face their charges, right?
It's just such a weird word, like you're talking about a car almost restored, I mean, I don't know, I just.
Restored to
struggle with
competency.
Well, I think they're just saying that they're competent enough to stand trial. They're not, so they can't commit someone to one of these detention facilities forever. I mean, they can't just stay there. They still have to stand trial at some point. They may be sent to, another facility as a result of the trial. But the bottom line, and the number is relatively low, who are sent to the detention facilities. It's just that the costs have gone astronomically high and we're paying for all of it now. That's what we're seeing in the numbers that Christine showed you.
Actually, those are the numbers, Rob. This analysis, you're just showing, this is just a 2024 cost.
Yeah.
I believe there was another analysis that you shared with us that gave it the historical perspective where you saw that it went from like 3 people a year. Now we're at like 9 people a year, and you do see the cost increasing, but then, correct me if I'm wrong, they're not astronomically increasing. I would think the biggest driver is length of stay.
Yeah, length of stay. Well, and the per diem, remember, it went up from, it was a little under 1,000 3 years ago. Now it's 1,500. So,
Yeah, gone up, but I think that it's a combination of the increase per day.
yeah.
And the fact that it's going from 3 people to 9 people, and the fact that it's gone from like 3 months, to 9 months, and several people, excuse me, over a year.
I mean, it's beyond our point of control or even our interest, but then are they restoring people with medication? I mean, that's another question, and
Well,
that more temporary restoral, I guess,
I think we just don't understand their process.
right?
I don't know from start to finish how things go.
What they do, they receive a combination of treatment and also it's almost literally like a training curriculum. They go through teaching the individual, like the role of the judge, the role of the prosecution, the role of the defense. They actually work with them on how you would interact with your attorney. How do you understand whether things are in your best interest or not? Those kinds of things but they are also offering treatment and medication as needed. Yeah.
Supervisor Bruno?
You have to ask obviously, what changed? I mean, if the individual back in 2016, what's the difference between that individual and the one today? In other words, lower number of individuals, number one, I guess, but also, were they not kept under observation or whatever it is, maybe not just observation, but rehabilitation, I don't know what the words are. Longer now, and for what reason? You know what I'm saying? It's something is gone off the rails, if you will. So,
Mr. Tyson?
Thank you, Mr. Chair. Just wanted to inform the committee that we do have this on the radar screen for our 3 representatives or 2 assembly personnel and the senator. So they are aware of this and they pledge to do what they can to try to bring it before the state in this legislative session.
Okay, any other questions for Mr. York? Well, thank you, Rob.
thank you.
Appreciate it.
Okay.
Anybody else from the public care to speak on this topic? Seeing none? Thank you, Rob. Yeah, we're just gonna wait now for public health. He's on the way.
Right now, there's
No.
Five years.
Pre-pandemic, she's allowed out. In fact, that I'm a little late.
Yeah, but
That's okay.
I laugh at everything.
I accept it.
Thank you. I was like, are you laughing at this?
Good.
This, because I thought you were talking this.
Yeah.
We all got another one.
Which one is
The
it?
second one?
Just,
Give us
just,
the-
they just hand it to us.
Thank you. We're all set for you.
Yeah, this is all, and this, you can have it.
You can.
Yeah. Yeah.
I'm making all kinds of friends.
Yeah,
It's
look
okay,
at
you don't
this.
have-
I got a lot this time.
I maintain it.
You can't even put your name on that thing. That's,
Right.
then you're hiding. You don't really have a.
Yeah, you think I want to take action on that?
Yeah. I thought that's what you meant, like.
Oh, no, I. just laughing at You, 'cause I did, I got.
I was like, we
coffee.
missed the first, I figured you were out here.
It's like-
Okay, so first, have a motion to approve the minutes of the prior. No, we already did that one too. I got time, baby, we're moving. Anyone from the public want to address her before she starts? No? No? Okay, Janelle, you're all set.
Good morning, everyone, and Happy New Year. Our first resolution request is to appoint and reappoint members of the Warren County Health Services Professional Advisory Committee for the term of January 1st of 2025 to December 31st of 2025 per the list that was transmitted with the agenda information. The PAC committee must be appointed annually by the Board of Supervisors by resolution per New York State Department of Health regulations. A copy of the members will be on file with the minutes. The meetings are typically held quarterly, and right now we're continuing to do them virtually, which works for most of the committee.
Okay, got a motion to bring this to the floor. Supervisor Runyon, second Supervisor Bruno. Any questions? All in favor? Opposed? Abstained? Okay,
Thank-
next.
Thank you. The second request is to appoint and reappoint members of the Local Early Intervention Coordinating Council for the term January 1st, 2025 to December 31st, 2025. Per the list that was transmitted with the agenda, which is attachment to the LEICC committee must be appointed annually by resolution per regulation. And a copy of the membership will be on file with the meetings, and this is typically a semi-annual meeting, and it's also done virtually.
Okay, motion to bring it to the floor. Supervisor Runyon, second. Supervisor Patchit. Any questions? All in favor? Opposed? Abstained? Okay, number 3.
Resolution request number 3 is to extend a 1-year lease agreement with Hudson Headwaters Health Network, aka Warrensburg Health Center, initially authorized by Resolution 109 of 2020 to provide space for public health, women, infant, and children clinics from January 1st of 2025 through December 31st of 2025, and to authorize the Board of Supervisors Chair to renew future leases as long as it's mutually beneficial and in a form approved by the county attorney. This lease is needed to ensure a provision for our clinics. This collaboration is not only beneficial for our participants, but it strengthens our relationship and collaboration with the Warren County or the Warrensburg Health Center providers as well that also work with the clinic.
Okay, motion to bring it to the floor. Supervisor Bruno, second Supervisor Runyon. Any questions? Okay, all in favor? Opposed? Abstained? Okay, number 4 to know.
Okay, the next 3 are fiscal, and as you notice, Ton is not here, so I'll do my best. Resolution number 4, which goes along with attachment number 4, is to amend our 2025 budget to reflect both revenue and expenses related to our health education program for the addition of $7,941.65, which is funding received from the Governor's Traffic and Safety Committee's Child Passenger Car Seat Safety Program. Ton is not here, but we had a $10,000 grant that was approved last October, and that remaining balance came over. And that's what we're requesting to amend the budget with.
Okay, motion to bring it to the floor. Supervisor Runyon, second. Supervisor Thomas. Any questions? Call the question. All those in favor? Opposed? Abstained? Okay, number 5.
Resolution request 5 is to amend our 2025 budget to reflect additional delivery system reform incentive payment, which is called Disrupt program funds, for 2025. This is the balance that was carried over from 2024 for the home care division in the amount of $5,107.18. We use this to do a lot of our technology stuff with our home care patients on our home care side, and we've been very lucky to have this funding.
Okay, motion to bring it to the floor. Supervisor Patchit, second Supervisor Runyon. Any questions? All those in favor? Opposed? Abstained? Okay, number 6.
The resolution request number 6 is to amend our 2025 budget to reflect 2 years worth of dual settlement award expenses and revenues in the amount of $190,942.56 for both the 2024 and 2025 shares of the dual settlement. This is about half of the anticipated total settlement award of $381,885.14. We were supposed to receive 2 payments by the end of 2024. We've reached out to the Attorney General's office, and we basically are told that they're addressing issues and will update soon. So because we couldn't utilize or accept the money in 2025, we're looking to do the 2 years in 2025. We're appreciative of this money. It's going to provide a wonderful opportunity to do outreach, education, preventive education. We're just patiently waiting for it, as all the other counties.
Okay, motion to bring it to the floor. Supervisor Runyon, second Supervisor Bruno. Any questions? Okay, all those in favor? Opposed? Abstained? Okay.
The other things that I have are just our typical discussion items. We have our report of revenues and expenditures on attachment 7. That's basically a comparison at this point of 2023 versus 2024. I think the other thing that we have is our comparison report. Again, that's the comparison from 2023, 2024, which is attachment 8. Han's not here. I would just maybe say if there's any questions, you could reach out to us and we'd be happy to get you good answers for that. We have our other attachments, our status of referrals, which is attachment 9A, 9B, along with our activities for our emergency response and preparedness, and also our rabies report. One other thing that I added that I've spoken with our health education people that I think, without objection, that I'll bring to the committee meetings is a nice colorful document telling you kind of what we're doing that month going forward, like kind of telling you what we're doing or giving us a status. Health education, for the month of February, or at least kind of January, February, I'm kind of giving you kind of little tidbits of what we're doing, being out and about in the community. It's pediatric dental month for February, so we've scheduled 8 visits to go to elementary schools to talk about dental health. We've got our Tar Wars program that you guys are very familiar with that we do every year. They've done a lot of visits already in January, but they've only got 4 more schools to go to for that. You guys might remember our colorectal colon that we purchased with performance incentive money. That was like free money from the state to do like a special project with. March is colorectal cancer month, so they've got a lot of places booked for us to put up and provide awareness for colon cancer. Heart Health Month is also in February, so we're going to be doing a lot of social media for that. And then one of the things that public health services are based on is a community health assessment, a community health needs assessment, and the community health improvement plan. And we're in the process of convening the first meeting of our 2025 to 30 phase and looking for the committee to do that. Dan's got probably about 25 people already signed up to be on that committee. So that's awesome. And then with that, I just want to bring to attention, we're looking for public input. So we're kind of doing a campaign that between now and May, we're hoping people will use this little code. Anybody, we're looking for regular people, anybody, everybody in Warren County to fill that out just to give us their input on kind of how we're doing, what they'd like to see. And then those responses go into our community health improvement process. So if you could encourage that or post that, or if you need a bigger link or something, Dan can help you out with that.
Well, does Don put this on our webpage?
Yeah, that you can do.
So
that.
anybody from the public who accesses our webpage can see that. They do Facebook with us too.
I'm sure they do. But any word of mouth also helps.
Okay.
Like, hey, I heard this really cool survey where you get to kind of impact what public health does, please.
Yeah, I see that happening.
Well, I thought at the hockey games, you could put it on the Jumbotron.
Oh,
With
you
your-
can't
with
put
your
anything
shirt
on the
giveaway.
Jumbotron without paying for it. And trust me, I know what paying for it means. Thank you, Janelle. Any other things, Janelle?
I'm good.
Anyone from the committee have any questions for Janelle? Okay, anyone from the public have any questions for public health? Seeing none, motion to adjourn. Supervisor Runyon, second Supervisor Bruno, all those in favor, signify